Hi viewers, I am Dr. Nisha, dentist. Today we are going to see about one of the most common health problem, diabetes, and how does it affect our oral health. What is diabetes? This is a condition that impairs our body's ability to process the blood glucose. Glucose is nothing but a form of sugar that we get from the food what we eat, and also it acts as a main source of energy for the cells in our body. So how does the cells in our body get the glucose from the blood? Here comes the hormone, the insulin. Insulin is the hormone which is produced by the organ pancreas, and it helps the cells to absorb the glucose from the blood. There are two types of diabetes, type 1 diabetes and type 2 diabetes. In type 1 diabetes, the body does not produce the insulin, and in type 2 diabetes, the body does not respond properly to the insulin. So in both the cases will result in increased level of blood glucose, which affects the other organs of our body. So now let's see about how the diabetes affects our oral health. Patients with diabetes has an increased risk for development of the gum disease. The gum disease is the disease which affects the gum and the bone which supports the teeth, and eventually it leads to loss of the tooth if it is untreated in its advanced stage. Recent studies have evidence that 1 in 5 cases of tooth loss is due to diabetes. How the gum disease occurs? The main cause of gum disease is the dental plaque, which is nothing but a white sticky coat which is built up around the tooth, and it contains the bacteria. The bacteria which is present in the dental plaque irritates the gums, that is our gingiva, and leads to inflammation of the gums. The condition is called gingivitis. Gingivitis is the earliest stage of the gum disease. Untreated, it progresses into the most serious infection, periodontitis, which affects our soft tissues covering the tooth, that is our periodontal ligament and the bone which supports the tooth, and leads to loss of the tooth. So let's see why the diabetic patients are at increased risk of development of the gum disease. People with diabetes are more prone to development of the gum disease. This is because the high blood sugar level will damage our blood vessels and decrease the supply of oxygen or nourishment to the gums. And also the high blood sugar level cause the level of glucose in our saliva to increase, which will result in the growth of more bacteria in our oral cavity, thus eventually increasing the risk of infection to the gums and the bone which supports the tooth. Symptoms of gum disease. Most of the time the gum disease are painless and the patients are unaware of it. Gum disease have some certain symptoms. If you notice any one of these, it's time for you to consult a dentist. So what are all they? Bleeding in the gums while you are eating and brushing your teeth, and if you feel any redness or swelling over the gums, if your tooth become loose, and if you feel some persistent bad breath, if you notice any pus formation in around your gum lines, and if you feel that your gingiva is shrinking, that is the gums are receding. Gum disease and the diabetes acts like a two-way relationship. Not only that the people with diabetic are more prone to gum disease, but also that if a diabetic patient is having any serious gum disease, that is periodontitis, it will be difficult for him to manage his blood sugar level, even if he had some medication and follows a proper diet. So correcting the underlying gum disease is really important for the diabetic patient in order to maintain a normal blood sugar level. Management of gum disease in a diabetic patient. If a diabetic patient has developed any gingivitis or periodontitis, it is really important for him to clean his teeth, which is done by the dentist, that is called scaling. In gingivitis, normal cleaning is enough to cure the disease, and in periodontitis, deep cleaning is done. If the patient does not respond to the deep cleaning, then surgery is the option. And even antiseptic mouthwashes is also used for controlling the bacterial activity. Dental caries. If a diabetic patient has a high blood sugar level, this will lead to the increase in the glucose in our saliva, so which eventually leads to growth of caries causing bacteria to flourish in the oral cavity, which will increase the risk of development of dental caries in the patient. Oral thrush. People with uncontrolled diabetes sometimes might develop a fungal infection called oral thrush. The signs of thrush include painful white or red patches over the mouth. In order to avoid this infection, the patient should follow the proper hygienic technique to clean their teeth, and they should keep their blood sugar level under control. Dry mouth. Some of the people with uncontrolled diabetes also experience the dryness of the mouth. This is mainly due to lack of production of the saliva. The condition is called xerostomia or dry mouth. Our saliva acts as a natural cleansing agent which will clean away the remaining food debris, any harmful bacteria and acids from our mouth. In absence of saliva, the patients are more prone for development of the dental caries and gum disease. Management tips for maintaining a good oral hygiene in a diabetic patient. It is more important for the diabetic patient to maintain their blood glucose level in a normal range. You should follow your doctor's instruction in order to maintain it in normal range. Thoroughly clean your teeth by brushing twice a day and cleaning in between the teeth, that is flossing at least once in a day. Have regular dental checkups at least once in 6 months in order to find out any dental infection in its earliest stage so that the treatment and management will be more easily for you. If you are a smoker, just avoid smoking because the occurrence of dental disease in diabetic patients who is smoking is 20 times more when compared to the patients who is not smoking. If you are a denture wearer, remove and clean them daily and properly. So these were some of the tips. Thank you for watching.